Cancer of the exocrine pancreas is a highly lethal malignancy. About 60,000 people in the United States get pancreatic cancer every year, and almost all of them die from the disease. Pancreatic cancer is the fourth leading cause of death from cancer in both men and women in the United States. Surgical resection is the only potentially curative treatment. Unfortunately, because most patients don't show signs and symptoms until after the cancer has significantly progressed, only 20% of patients are candidates for pancreatectomy at best, meaning removing the pancreas from the body. But even still, prognosis is poor even with surgical resection, as the 5-year survival is no better than 30%, and that's the best case scenario. In general, more people in the Western or industrialized parts of the world get pancreatic cancer. It's pretty rare before the age of 45, but average age is around 55 to 60 and is about twice as common in men. In the United States, the number of people diagnosed with stage 1A pancreatic cancer rose by 15% between 2004 and 2016. The 5-year overall survival rate for stage 1A pancreatic cancer, it went from 45% in 2004 to 84% in 2012, and this is most likely due to earlier detection. And this is why it's so important to know what the early signs of pancreatic cancer are. When the cancer is in the head of the pancreas, it typically causes abdominal pain, weight loss, and probably the biggest clue of all, progressive obstructive jaundice, meaning yellowing of the skin and the eyes, and that results from the accumulation of bilirubin in these tissues. Not everyone with pancreatic cancer gets abdominal pain. In fact, painless jaundice occurs in 25% of those with pancreatic cancer. The sclera, meaning the whites of the eyes, are usually the first tissues that you notice turning yellow when you develop jaundice. Other symptoms related to obstructive jaundice include dark-colored urine, the stools become light and clay-colored, and the skin becomes itchy. Another common symptom is fatigue, just feeling tired all the time. If someone does have pain from pancreatic cancer, the pain is initially intermittent in nature and later becomes a steady pain and is localized in the epigastric region, so right up in here, and it typically radiates to the back. The pain is worsened when lying down and improves when standing and bending forward. Here is the full breakdown of the most common signs and symptoms by the numbers. Most common symptoms: weakness, fatigue, weight loss, anorexia, abdominal pain, dark urine, jaundice, nausea, back pain, diarrhea, and vomiting. So those are the warning signs and symptoms of pancreatic cancer. But it's not possible to reliably diagnose a patient with pancreatic cancer based on signs and symptoms alone because they're not specific. These symptoms can also be caused by things like pancreatitis, which is inflammation of the pancreas, and even IBS, irritable bowel syndrome. Usually the diagnosis is based on blood tests as well as imaging such as an ultrasound or a CAT scan of the abdomen. When it comes to blood work, levels of bilirubin, CEA, and CA19-9 are frequently elevated. But let's take a closer look at the biggest environmental risk factors for pancreatic cancer. In the 2017 Global Burden of Disease Study, so this is worldwide, deaths related to pancreatic cancer were primarily attributable to smoking, which was 21%. 9% was related to having a high fasting plasma glucose, and 6% was related to being overweight or obese. It's estimated that smoking cigarettes increases the risk by about 20%, and the more cigarettes smoked, the higher the risk. Now, there's many studies that have evaluated the relationship between diet and pancreatic cancer. Now, a typical Western dietary pattern, which is high intake of saturated fat and or meats, especially beef and pork, particularly smoked or processed meats, has been linked to the development of pancreatic cancer in many studies. A case control study found an inverse association between consumption of a healthy diet and the risk of pancreatic cancer. So basically, those who had a higher intake of the healthy stuff like fruits, vegetables, whole grains, lean meats, beans, and the healthy oils, things like olive oil and the oils that come from fish and nuts and seeds, those people ended up doing better and having a lower risk of pancreatic cancer compared to the typical Western diet. Data regarding the impact of coffee and alcohol ingestion on the risk of pancreatic cancer have been conflicting. Two pooled analyses suggest that if there is an effect of alcohol consumption, it's very small and limited to heavy drinkers. And when it comes to coffee, there's also no conclusive answer if it actually increases or decreases the risk. Now, when they looked at a bunch of people who developed pancreatic cancer, they noticed that they had, generally speaking, lower levels of lycopene and lower levels of selenium. Lycopene is a lipophilic carotenoid hydrocarbon pigment found in red, pink, and orange fruits and vegetables such as tomatoes, apricots, melons, papayas, grapes, peaches, watermelons, and cranberries. The amount of selenium in foods can vary widely depending on the selenium content of the soil in which a plant is grown. So when eating plant foods, the amount of selenium that you're getting really depends on the amount of selenium in that soil that the plant was grown. Protein foods from animal sources are generally very good sources of selenium. This would include seafood and lean meats, even organ meats, but also Brazil nuts are very high in selenium. And what about diabetes? There's many epidemiological studies that have described an association between diabetes mellitus and pancreatic cancer, but it's not clear whether abnormal glucose metabolism is a consequence or a cause of pancreatic cancer. If you enjoyed this video on the warning signs of pancreatic cancer, you'll probably enjoy this one on the warning signs of colon cancer as well. So check it out.